Thanks, Rob. Invite my panelists to join us. So, as we like to say at the Twin, we believe that the mission of innovation is to improve the prosperity of the world and to foster human flourishing. Last year's Twin sparked a series of conversations and discussions and some work that's being done now on a vitally important topic, a topic I know is near and dear to your heart, Brian, and your purpose as a company, which I'd love to have you expound on in a second. And with the frame of it is this: with populations rising over the next 30 years to 10 billion people, how are we going to nourish the world? And in what ways are we going to have to rethink food and our whole approach to food? So I'm joined by our panelists. You've seen their bios, and as Rob likes to say, a precondition of coming to Twin is that you can read, so I won't have them do their bios, but I'd like to start with you, Brian. You have a bold purpose at Griffith Foods, blending care and creativity to nourish the world. I noticed it's not feeding the world, it's nourishing the world. Is there a difference?
Yeah, fundamentally, there is a difference. And when we kind of embarked on articulating our purpose as a part of the journey, that was something that we discussed. 7 different languages, in fact, when we were exploring that. And as a company, we're a new product development company that co-creates recipes with companies around the world, everything from startups to big food. And so when we looked at fundamentally what our purpose was, which was, we used a kind of construct which Aristotle spoke of, which is where your unique and authentic talents lay and the intersection of the needs of the world, therein lies your vocation or your calling, and which is, in Greek. And so we fundamentally looked at that, and so the blending of care and creativity to nourish the world was fundamentally, for our past 100 years, the ethos that we operated from, and it captured our past, our present, and more importantly, even our future. And so this idea of nourishment very much is around the creation of sustainable, accessible, delicious, and nutritious recipes. And that's fundamentally our skill, our capability that we bring to the food world. And we kind of operate that way all the way from how we, raw materials that we develop with to, our customers and how we deliver that. And we believe deeply that how we do that, this idea of nourishment, is both from food is, culturally intertwined. It's the literal translation of how we actually provide both calories and nutrition, but it's very much bound in the soul of how we show up as a company and partner. And everything we do is a co-created partnership process. So we sit in a unique space for that. And so this idea of nourishment is really what we see as fundamentally what the world needs, not just nutritionally, but how do we show up in something that is so integral to each and every person, to communities, and how we operate. So that is that it captures more than just this idea, and definitely beyond feeding.
Yeah, because there are a lot of people in this world that are talking about how we ramp up our food production to meet the supply of food that we need to feed the world, but you're talking about something deeper and more profound than that. It's actually about empowering human health through food.
Well, I think in so many of our speakers, we talk about the reality of the situation, and our co-panelists here are going to talk about, how does that translate?
Right.
Because the reality of the situation requires, a broad approach.
Jack Bobo, a dozen years with the State Department, global food policy, a global thought leader. I've heard you speak before, Jack, on several occasions, and I've heard you push back on people that say that our food system is broken and that it needs to be reimagined. But yet I look at data like we have 800 million people on this planet that are malnourished. We've got 2 billion people that are overweight or obese. And so that's nearly half the world's population. So how is it possible that our food system's not broken?
So I think a lot depends on the baseline. If we use today as our baseline, then it does look broken. 800 million people will go to bed hungry tonight, and that's totally unacceptable. But if we went back 30 years, it would be 24% of the world population would be going to bed hungry. If we went back 50 years, a third of all the people on the planet would be going to bed hungry. So things are getting better, but not fast enough. And I think that this concept of nourishing versus feeding is critical, because think about it, for 10,000 years of human civilization, feeding people was all that mattered. Today, we're at that unique moment in history in which we can begin to think beyond feeding to nourishing. And that's really only happened in the last few decades, that transition has happened. And so I think that when you look at things like obesity, part of it's that we haven't figured out how to make that transition yet. It's not that people aren't trying, that they don't want to do a better job, but we don't know what that new future looks like.
Right, right. So in a sense, would you agree with the statement that it seems like we optimized for something in the past, which was really to provide accessible, affordable foods, but what we need to optimize for in the future might actually be different than what we had to optimize for in the past. Would you agree with that?
Well, I think that's true for the 6.5 billion people that have enough food today, but we still need more food for those who don't. So we're going to need to do both as we transition into that world, hopefully where we're nourishing everybody.
Yeah, that's great. Nora, I'd love to turn to you. Your organization was founded by a doctor of all things, and Dr. Jordan Schlane, who's been a member of the Twin and been here in the past, and like I think we heard Darshak say a few minutes ago, is very passionate about the fact that we need to think holistically and operate holistically. And Rob mentioned a few minutes ago that we were backstage, but this idea of proximity, that we're pushing more and more closer to the point and moment of demand. And that's a factor that's shaping markets. So you're focused on how do we bring healthy food and make it more accessible and have it fit into that point and that moment of demand and meet people where they are. Can you tell us a little bit about what you're doing and why?
Yeah, at EatReal, our nonprofit that Jordan founded with other leading doctors and health advocates, we're really focused on helping kids learn to love real food. And so really, and we see our work in building the movement of demand amongst kids, demanding that real, healthy, nourishing food so that they can create the pull and the demand that then can cause the market to respond. And so when we think about why we're doing this and Jordan's motivation around starting this, he talks a lot about how our model today is broken in that the structure of our model is very reactionary, that we don't have a proactive model, that truly our healthcare and how we care for our kids and how we care for our people, our healthcare model is truly sick care. And when we look at the reality of the numbers, today 17.9% of our GDP is healthcare spending, or $3.5 trillion. And that healthcare spending is on responding and treating symptoms, not actually getting to investing in health early on. And so our nonprofit is about getting health through food, and really food is medicine, and food is at the core of creating a healthy next generation.
So a lot of the talk that we have is about adults that are overweight, obese, and so we just talked about that, but you're focused on kids.
Yes.
Why kids? I mean, that's great. I mean, I have 3 kids. You all know that. But there's a specific focus, I think, as to why kids.
Yeah, 2 key reasons.
Yeah.
One, I think bad habits die hard, and the older you are, the harder it is to break habits. And so we really believe in starting to change children's habits and helping them develop healthy lifestyles and habits early. So we really think that it's critical to focus on the next generation. So number 1, it's possible. It's so possible with them, and it's easier to affect change that way. And then 2, that the reality for our kids is, I think, harder than people realize. People talk about the reality for our kids. It's like a slow-moving car crash, in that and I actually joined this nonprofit because I learned that my daughter's generation is the first generation that's expected to have shorter lifespans than their parents. Our kids in the United States are going to have shorter lifespans than us right now, unless we do something. And we can do something. There are bright spots. We can fix this. This is a new problem, and I believe in us. And so we're really, because of the reality facing our kids, 1 in 5 have obesity, 1 in 3 are on track to develop diabetes, 1 in 2 children of color. The numbers are intense. So it's urgent and it's important.
We feed a lot of kids too in our
Yes.
schools.
Yes.
Yeah, so I've heard you say before that the school system is like the largest food delivery system or something to that effect.
Yeah.
Want to expound on that?
We're focused on helping kids love real food at school. And
Yeah.
so I didn't realize this, but schools are actually the largest restaurant chain in America. One in 21,000 school districts, one in every single community close there. And if we can change our school system that provides so many calories for our kids and can provide so much nourishment, then we're going to change the trajectory for our kids. And today's, I would add that it's not only the largest restaurant chain, it's the largest fast food restaurant chain. And we think that because one, kids have about 20 minutes to eat, they're scarfing down food, and then it's highly processed. When you look at the state of food today, we need to change the food at school to make it more nutritious.
Yeah. Wow. Thank you for doing that. And Susan, let food be thy medicine, let medicine be thy food, right? Nora mentioned food as medicine. You're actually working in the field of food as medicine. What's your vision for Savor Health, and why are you doing what you're doing?
Well, first and foremost is because food's both the problem, but it's the answer. And so if you break it down and you look at the health issues today in and around food and nutrition, what we eat, and we eat too much. Okay, so that's one thing. Then you look at, we're focusing, our first use case is on oncology. And so there's research in and around red and processed meats and a correlation with a higher risk of colorectal cancer. And I'm not bashing the meat industry, by the way. But you look at that, and then you see a vegetarian who's healthy and runs and dies of cancer. The point is, it's really complicated. And so what we've done is we're focusing on oncology as a first use case to attack a very complicated problem by applying machine learning to unique patient variables and then applying where the evidence is today, the scientific literature, and providing interventions. And that's where the solution comes in. If you think about, and you go back to the 90s and you look at the healthcare industry, capitated risk and things like that, we had utilization management. We did that in an analog way. So we had call centers all over the country, focusing on keeping people from utilizing too much resource. I'm simplifying that quite dramatically. But then we went into the 2000s and we applied a digital solution pretty much to the same way. We just applied technology. Today, I think, and somebody said this yesterday, Pablo, I think, the speed of computing has gone up dramatically. The cost has gone down. We can now apply machine learning to this problem because, it's not as simple as meats versus fruit and vegetables. It has to do with things like your genome, your microbiome, but also what are you allergic to? What do you want to eat? We also have to remember, let's do this contextually. What do people want to eat? Let's help them and empower them with information and resources that give them back control and help them take control of their health and nutrition.
That's exciting. Well, you mentioned plant-based diet as well, and I know you're not an anti-meat person, but we hear a lot about plant-based diets these days, and actually with the rise of things like the Impossible Burger and Beyond Meat and all of these, espousing both the benefits of plant-based diet, but it seems to me that when you look at some of these new foods that are coming out, and Jack, I don't know, you may want to comment on this, some of these new foods that are coming out don't seem to be as nutritious as they should be. Like, are we trading off sort of planetary health in the sense that we're making more sustainable foods with Beyond Meat or Impossible Meat and espousing the benefits of a plant-based diet, but are we creating future problems with not serving people healthy enough options?
Well, I don't think all foods have to solve all problems.
Okay.
And so when you think about plant-based, largely the nutritional profiles are similar. They have maybe a little more sodium, but over time one expects that to get better. But the environmental impact can be quite different. And so for me, what the challenge is that consumers are buying the products because they believe they're more nutritious, when the actual benefit from the company's perspective is environmental. That disconnect, I think, is a risk to adoption of new technologies when people are doing it for the wrong reason.
Yeah.
The other thing I would add to that is I think the nutrition industry has done itself a huge disservice. There's a lot of misinformation. We talked about this yesterday. And so we need to, it's not as simple, again, as just a plant-based diet. There are many other factors that we need to look at. And so you mentioned the sodium. So that's a problem with these plant-based, Impossible burgers. They're not really that healthy from that perspective when you put it all together,
Right.
especially for cardiovascular health in particular.
Yeah. Brian, did you want to?
Well, and I think what it is it's popularizing. If you talk to these companies, what they're trying to do is kind of mainstream alternatives. And fundamentally, this is increasing the ability to choose. The content of that, I think, is something that we believe that is a continuum. And as people learn more about their food, but even the connection between environmental and choices being made around what they're eating, and then understanding the content of that is, I think, a significant growth in terms of people caring about their food. And there are, as you said, Jack, there's not a perfect solution to this.
There's not one solution.
No.
Not one solution. I'd love to hear each of your perspectives on who needs to be at the table. I mean, these issues are complex issues, right? So getting people to change their behaviors isn't just a matter of, sort of regulating, having a sugar tax or driving change through a regulatory process. These are complicated issues that are intertwined with, what we produce and how it gets to us, and even how we engage with the healthcare ecosystem. So what has to change, I guess, and who needs to be at the table to really move the needle and make the change that we're talking about to empower health through food?
Yeah, I guess I'd love to share. We believe that it takes an ecosystem approach, and so that you really have to map the stakeholders and be intentional early on about what does your environment look like. And so in our work with schools, we really look at who are the decision makers, who are the leaders, how do we engage the students, the staff, the food service directors, the parents are key, the leadership, local government, local businesses we're bringing into the mix to sponsor some of this work and to participate. And then what other nonprofits, because we shouldn't do it alone, none of us, whether we're a business acting alone or a nonprofit, what other nonprofits can we bring in and act as a link to bring people together to really bolster the ecosystem? So we work with school garden nonprofits and work with curriculum experts, and then bring in additional resources to the school, and then look at the broader, and then keep zooming out of, okay, well then what about the suppliers, and what are retailers' roles in this, and what is press's role in this? And so we really try to create that that collaborative approach within.
So that makes me think, Brian, do the innovation agendas of big food companies need to change? I mean, are they even focused on the right things? And in what sense might we need to sort of change the whole innovation focus of large food companies to start making progress and address this challenge?
Well, I think, fundamentally its role, of any business is to focus and understand the broad needs that we're trying to solve. And go back to our purpose. Yep. I think the purpose of business is really to kind of tap into how can we make a difference in the world. Yep. So this idea on the innovation agenda, fundamentally is, whether it's a startup or whether it's big food, it's around being able to focus on the outcomes that matter, that make a difference. And I think the stakeholders in that, whether it's regulatory, by the time something is regulated, any business that says we're surprised,
right.
Legislation doesn't happen overnight. It's typically decades. Proactively is addressing what those needs are, in conjunction, ideally, with NGOs and nonprofits, with government, to actually solve some of these what may seem to be intractable problems.
Yeah.
So the idea of the innovation, no matter what the size of the organization, I think fundamentally is that there is opportunity and growth to make a difference. So this idea of business as a force for good, I think, is fundamental to the ability of how business can lead in conjunction with other partners.
Yeah, I would just add that it's engaged, informed stakeholders unfortunately today, consumers have never cared more nor known less how their food is produced. And if you care passionately and you have no idea what the food system, then you can advocate for policies that might actually undermine your goals.
In what sense?
So if you believe that one particular approach, there's a push for fresh foods, and I'm a huge fan of fresh foods, but if you're on a fixed food diet or a fixed amount of money, well, frozen food, you could buy twice as much for the same amount of money, and nutritionally it's pretty much the same. Yeah. There may be a taste or quality difference, but we're stigmatizing frozen and canned and things that could benefit. And so I think we need to have a more expansive view, and that's where engaged, informed stakeholders are critical.
Yeah.
And I think I think part of that's education, and it's applying scientific rigor to these problems, and then having information versus misinformation, fighting misinformation with information, and I think we all together have to do that collaboratively, because otherwise there's too many sources of truth.
Yeah, yeah. And the healthcare system is going to have to be engaged and involved, and this is paradigm shifting in a sense for healthcare to rethink the role of food and shift, as you said, from disease care and sick care to true empowerment of healthcare. So I want to be sensitive to our time. In a minute, I'm going to ask you a closing question, and I'd like to get your answer to the following. Today's about projection. Rob said, vision is also about projection. And so if you were to look out 10 years from today, what do you think would be a headline that would describe, a news headline that would describe how we're looking at food differently 10 years from now versus where we are today? What would be that headline? And while you're thinking of your answer to that, I want to announce that last year we sparked a conversation around nourishing the world, and we spent a lot of time focusing on where can we make a dent in this, and where can Twin play a role in this very busy world. There are a lot of people focused on how do we produce enough food to feed the world, and increasingly there's a lot of focus on the sustainability aspects of our global food and ag chain. And so we've spent a lot of time in discussions and working sessions and roundtables talking about where we can play a role. And I'm pleased to announce that with the support of Griffith Foods, we're launching a catalyst, just like we did in the mining sector that you've heard about, a catalyst which will be next month in the Netherlands around nourishing the world to 2050. How do we empower human health through food? We're bringing together 40 to 60 global thought leaders from healthcare, from food, from agriculture, technology, et cetera, all focused around this issue of how do we make food more functional, more accessible, more sustainable, and more desirable. And so we're meeting on that topic, and there's a very good reason for it, because this is a crisis, really, that we're facing. If we look at even diabetes alone as one condition we know is linked to our health, diabetes alone will be a $2.2 trillion problem by 2030, which means that if you were to convert that to GDP, it would be a G8 country. So our food has a material impact on our health, as we know, and actually it's becoming a global threat to the prosperity of the planet. So we are launching this dialogue and this conversation around the Twin Catalyst, Nourishing the World to 2050, Empowering Health Through Food. I'd encourage any of you, if you're interested in being a part of that, please see me or please see Brian. We'd love to have you join us in that journey. So now, your one-line headline, how are we going to be looking at food differently 10 years out?
10 years
Susan.
out, I want to see a headline that says, patients receive Food RX based on clinical evidence and highly personalized and clinically and contextually appropriate for them.
Great.
That's what I'd like to see.
Awesome. Nora?
Our wealth is our kids' health, I think.
Our wealth is our kids' health. Beautiful.
Our food supply has never been safer today in the history of the world, and people have never been more fearful. What I'd like to see is food fear is dead.
That's great.
Great. Brian?
It would be, I mentioned it earlier, it's, sustainable, accessible, delicious nutrition. And I believe that 10 years out, these things are attainable. There's some things are happening now, but collectively. And I think this is the power of the twin. Of each and every person in this room, their fundamental optimistic belief around the possibilities of creating a better future. And so food stands central to that. And so those kind of 4 words around our future of our food, I believe in.
Nourishing the world to 2050. Let's make it happen. Thank you. Brian, thank you.